All right. Well, we are on week 3 already. So this week we're doing all the reviews. I did post the times on your calendars, so you should be notified. I also put them in the announcements. In the announcements, I also put the Kahoots. I put the study guide. I also put the math dosage calc questions from the first exam. As in, if you can answer those types of questions, those are the types of questions you'll see on the exam. Okay? Different names, different numbers, but types of questions, they're there. So if you cannot work with that math sheet, get it done. Your class is on Tuesday. I can meet you before you have your exam next Tuesday to make sure that we can get that math done and no points off for dosage calc, okay? So week 3, we're going to be going over school age adolescents. Kids are getting older. We've done our quiz already. Overall, the scores are okay. There is a CJ Sims due. Be aware I need those 4 components on it. I need the name of the Sims, your name in the upper right-hand corner, your score, and the date of the Sims done. Okay? Those are the 4 things I need. And for any chance, if you had to repeat, it has to be this quarter. It can't be an old one. So it must be done again and sent with that information to me. And I'll be getting it. I mean, as long as you get above a 90, you're going to get 100. So go forward with it. The one thing I tell you about CJ Sims is I know a lot of the answers are out there. It's easier just to click, click, click and get it done. But these CJ Sims are helping you think. And if there's things you don't understand, go and look it up. Is it in something that you need to a definition, something to go to a book? Or is it something that you have a question you might ask me about? Is it a medication? And I've had students, as I've said, they do really well on the HESI because CJ Sims helped them think. So just to put that out there, try to do them as best as you can. So let's go ahead with our PowerPoint.
What about your NCLEX questions? What you want?
And just questions. Okay, that's a good one. On the NCLEX questions, if you go to the module and see NCLEX questions, you're going to see it to be done on growth and development. So there's a PED section, and then there's above it a growth and development. In that section, you click infants, toddlers, preschoolers, school age, adolescents, and then it will come up with new questions. So this is really more on all on your growth and development. It has nothing to do with the pediatrics area, so be careful. And it's great to do right before the exam because you're testing yourselves on things that you might see. It's a good one.
Is there
So,
remediation, and what's your score that you want?
okay, on NCLEX questions, we don't do remediation. The score is whatever you give me. You can do them over and over again till you get the score you want. I always tell a student in any homeworks, you must get at least at 78 passing so that your homework grades are not going to pull you down, especially if you struggle with exams. Okay? So above a 78 is my, what I'd say. If I see a low NCLEX score, I'm going to send a message to you. Are you sure this is the one you wanted me to submit? Because as of the PowerPoint the first week, it says if you submit it, that is your final, and that's the score we accept. Okay. So if I see a low one, I'll give you a chance. Because it can. It's actually, if you look at it, NCLEX are 1.25% of your overall grade, and it can pull down your grade quite a bit. So just be aware of it. So thank you for asking that. So week 3. So we start out with preschoolers. So now we are over the preschoolers. We are growing up, we're in school. It is ages 6 to 12, generally. Sometimes you see 5, sometimes you see 6, but you can say about 6 is the low number on school age. So what happens? It starts out with at age 6, all of a sudden your baby teeth start coming out. That's at age 6. That's that, developmental number. It doesn't mean all kids all of a sudden at 6 their teeth start falling out. It's all at different rates and stages. All right. Christian didn't have it till he was 7.5 and one came out. So it's all different, all different ages, and that's all okay. Again, growth is still slow, plateaus, it goes up, and they get skinny and a little pudgier. There's very, very, very slow. But if you look at ages 6 to 12, it's a lot of time. So they do grow a lot physically, and they're almost into their adolescent growth at that point. The one thing we have to be careful of is there are some children who look old and they're actually young. And I'm going to give you the best example. It's something near and dear to me. My second grandson is just turned 9 years old. He is 145 pounds and 5'4", solid football tackle guy. But he's just a 9-year-old. He doesn't understand more than that. So be very careful. And if you ever work with children, because they look physically old doesn't mean that mentally they've caught up there. Okay. As I said, everything is slow up. Weight almost doubles by the end of it. Like I said, it gets a lot in those 6 years. And then boys and girls are still the same. As when we get out of school age and adolescence, then we see the boys get taller than the girls. So we know that it starts out with that good old saying is all I want for Christmas is my two front teeth, right? That's that loose age at age 6 when they do those pictures and school pictures and they're missing teeth or both teeth, and it starts through those school age areas. Now, before this, in their movements and the way they run and hop are awkward and a little bit still not as, graceful as they should be. They get into school age, now their muscles, their body proportions, everything is sort of matching up. So they're getting more and more agile as they get older into the school age. Their body systems now are getting a lot more mature. Um, we know, I think the one thing that I think of when I think of bladder and the bladder capacity increases, I think of my children and going on car rides. And I know my daughter every hour and a half had to go to the ladies' room, whether or not she drank anything. So bladder capacity increases on most children. Obviously not my daughter, but you can see they can last longer in between needing to go somewhere. So traveling is easier. Their heart, which looked like their whole chest when they're little, now is looking smaller, more proportion. Now, they've been sick. They've got all those viruses. How many immunizations by this point have they gotten? So their immune system is really getting more and more effective. Their bones are getting tougher. And as I already said, physical maturity, it doesn't correlate with emotional or social maturity. As in, they may look old, but sometimes you know that they need a little bit more extra explanation or maybe help with other children. One of the things we know that children, even school age children, good kids doing well, good at school, all of a sudden we start to see them get some behavioral changes. This is a big red flag. It could, when they're showing these behaviors, could be falling of grades, could be not listening to the teacher, hitting children, or yelling, type of behaviors. This is now showing the teacher something's wrong. That is usually stress. That's the way a child that will do it. Younger kids, remember, they might start sucking their thumb again when they're stressed, or their finger, or they might be incontinent. They might, regress, to a bottle, go back to pacifiers. That's younger kids. School age children, Usually it's physical. You'll see it coming out. You'll see them angry for some reason, and that could be that behavioral change. Now, boys do not mature and go through puberty as quick as girls. So, about 10 years old, girls start with their puberty. Now, puberty, what's the beginning stage for little girls? It's those little breast buds. And usually, when you see those beginning of breast buds, it's about 2 years. Then you see them when they get their menses. And of course, they've gone through the curves and they've gotten taller and all of those things and the hair and getting more breasts and etc. But it starts at age 10 in girls on average. It's not till age 12 in boys. So I've always said that when I was back in fifth and sixth grade, I always thought boys were a little silly. I think it has to do with that hormonal and not being as mature, going through that puberty like girls do younger. That's the age when, I don't know, maybe not anymore for girls and boys. Now, how do you assess the school age children? Well, we've already started with preschoolers and with toddlers and infants, when to listen to breath sounds when an infant's quiet in mother's arms. Absolutely, heart and breath sounds. And a little toddler, get down below their level, open up that conversation, make yourself non-threatening, let them play with the toys, then do your assessment. School age children, well, they understand more, don't they? So if this is the one where on the level of the child, explain what you're going to do. And that's what a school age child wants. They're thirsty and they understand. And they have the ability to say, I don't get that. What are you saying? So it is great, school age children, for them to talk to you about what's going on and what's going to be happening. And they do really, really well with it. Now, a 6-year-old and a 12-year-old in school age, it's a big, big area. So a 6-year-old, I might have to say, you're going to have to go get a picture of your chest. It's a big camera. And it just takes a picture and I can see your insides. Now, an older kid, you say an X-ray to a child, sometimes they think gamma radiation rays are going to go through you and burn you. So you've got to be careful the way that you explain things to children. But the one thing as a nurse I've always done, and I had that ability, we had X-ray and computers in every single room and every little area next to that child. And I, especially broken arms, even constipation, I would show the child it, and then they would understand it, and that could help them take care of their cast or for their arm, their leg, their wrist, or whatever. I think that knowledge is the best thing. So, but again, what level is that child? Is it that 6-year-old or that 10-year-old? There's a big difference. We don't necessarily have to do a head to toe, depending on the child, but we can on the older children. I think actually after age 8, children are more like an adult. So yes, but again, you got to work around the child. You have to look. I think just looking at a child, I can see so much. Are they sitting there doing nothing? Are they pale? What's the color of them? How are they breathing? Are they sitting? Are they moaning, groaning, crying? I mean, all these things, right? And then you can listen, percuss, and palpate. This is more like even into the abdominal cavity. Lymph nodes. Children who do not feel bad and are not sick should not have lymph nodes hanging out. If those lymph nodes, like in the neck and underneath the chin, are coming out, that child's sick somewhere, whether it's a strep throat, ear, something. The kid's sick. That is telling you that the immune system's working on overdrive for something. In health assessment, they taught you about the hypoglossal nerve as part of your assessment. You can have even young infants will stick their tongue out for you on assessment. It used to be one of my challenges. How young can I get a little kid to stick their tongue out? And I'd stick there to stick my tongue out and put it in and out and in, and all of a sudden a little baby, their little tongue would come out. And it's non-threatening and it's fun. So we can assess that really well. breath sounds, a little bit tricky on children. Everything is short and small in there, right? And little spaces in between, the upper airway and the lower airway. Where you put your stethoscope makes a big difference. If you put it over the trachea, right at the substernal knot, just like between those two clavicles, right there, you put it. This is bronchial. This is all what's going on in the bronchus. You want more of breath sounds, you need to go below. Children tend to be, most of them have some sort of mucus in the upper airway. And sometimes it's referred sounds that you think there's rhonchi in their lungs and it's upper airway. Listening to the bronchial breath sounds or listening to the neck, I can say it's up here and then realize it's not in the lungs. So listening to lungs can be something. Now, school age. School age and Freud. Well, this is the only word that doesn't have anything sexual in it for Freud. It says latency. But what he's talking about with latency is their children start having relationships with their same sex peers. So now they're with other people other than their family. It's that psychosexual development. Kids get together, same sex talk. This is what Freud talked about. Same sex peers. Erickson. All right. This one's a little bit tricky to remember, and it will be on every exam you ever see. It's going to be on your exam, it's going to be on your HESI, and I'm sure probably this one is going to be on your NCLEX when you go take it. Erickson, school age children. Remember, he's talking about psychosocial, how you deal with the outside environment, right? So Erickson says school age children love to have a sense of industry. Now, what does that mean? A sense of industry? Well, let me describe industry to you, and then we'll figure this out. Industry is their house, their factory, the product that they produce that they're proud of. Industry. My product is I'm great at math, I'm terrible at spelling. But my industry, I'm good at writing, I'm good at da 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 da. And they do get that praise, and it's peer approval. Okay. Now, do children do everything well? Do you do everything well? So I have my industry. I got my product I do well. But what about I'm horrible at spelling. I can't throw a ball. I can't run. I'm clumsy. And it makes me feel really bad. And it makes me feel a sense of inferiority because I want to do everything well. And that's a school age child. Does that make more sense to you? Now, Piaget. All right, remember, Piaget is all about thinking. Remember, the first thing they learned how to do was suck, swallow, and breathe. That was a big thing. Well, then they learned how to take the rattle and shake it, and then put their finger in their mouth and suck it, and take the sippy jar up and knock it on the floor, and mom comes, and then riding around like an airplane, and riding a broom like a horse, doing all this magical stuff. Well, what Piaget says at this point, children, if they've seen it before, concrete, you could touch it, feel it, know it, smell it, you've seen it, concrete, you can repeat it. So if you've seen somebody do something, you can repeat it. So you had to see it to understand it to do it. Okay. So that's concrete. He also says you're starting to think really conceptually, as in if you have 10 nickels, and if they're lined up, they're 10 nickels. But if they're smushed all over the place, they're still 10 nickels, right? So that doesn't matter the way that they're lined up. Younger kids might think that's different. Another thing, conservation, what he says is you put a glass of milk from a short, fat cup and you put it in a tall, skinny cup and you put the same amount in each and you take a preschooler and they'll ask you which is more, what do they want? They want the tall, skinny cup. They think it's more. The school age child will know it's the same amount. That's the conservation and what they're talking about. Okay. But mostly Piaget, when we talk about it's that they master conservation, they know the difference of classifications, et cetera, and they are concrete. If they've seen it before, they've touched it, looked at it, felt it, been there, they can replicate that if they want to. That's Piaget. Those are all of those things about moving things around that one and the other both are the same. Whether it's lined up, not lined up, big ball of clay, smush ball of clay, they're still the same thing in either one of those. And school age children understand that. All right, we went. All right, we did that already. Now, formal operations, I'm going to mention it now because this is your older school age, but usually we describe this as adolescence, all right? When we think of Piaget and we think about Piaget in the adolescence, we think of formal operations. Well, we had concrete in school age, right? They had to see it, touch it, know it, and they could repeat it. Well, when it comes to adolescents, they can figure everything out in their brain and they're going to get what they want, what they need. As in, I was a parent, single parent, two adolescents. Okay. They knew what they had to do, how to do it, when to do it, why to do it, what to say in order for me to change my mind and let them get off of punishment and go to that birthday party they wanted to go to. That's formal operations. They can figure it out. They don't have to be shown it. They're logical. They can think. They can figure it out. That's the difference between school age, I have to see it before I can do it, concrete, and formal, oh, I can figure it out for anything. I'll get what I want. Now, Kohlberg. We normally talk about preschoolers in Kohlberg and morality. We talk about reward and punishment. When we talk more about Kohlberg and school age, is they conform to rules to please others. They want to be good kids. They want to please teachers and coaches. They want to do what they should do because they like the praise. That is Kohlberg in school age. Spirituality, concrete terms. What does that mean? Whatever they've seen and known, experienced, that is the spirituality that they know. They've never seen it, they don't know it. But whether I've introduced it or maybe they went with a best friend to the house and they're a different religion and saw different stuff, they've seen it somewhere. And the one thing about spirituality, and it still continues up from preschoolers, is they still feel that when something happens and they get sick, they fall down, break an arm, or they get strep throat, or their appendix, needs coming out, or whatever, they feel that they've done something wrong and they feel like they're being punished. Okay. So, one of the things, again, with this group, I'll let them know if they have to go to surgery that, you did nothing wrong. The appendix wanted to come out, or if something happens, it's okay. You're going to be all right. And then, of course, the younger kids, I'm going to put an extra stitch in there, and some of the younger school age children. But again, sending a kid to surgery with a better outlook in the mind helps. And you can actually, I've seen the difference in them. School age children are now starting to get in all sorts of clubs. They are out to Taekwondo, they're out in Girl Scouts, Boy Scouts, Cub Scouts, whatever. gymnastics, things. And these are a lot of their peers. Remember, peers, same-sex peers, they're really starting to communicate there and getting those best friends there. Um, and it's good to get out and be and with these groups. And they're going to be, doing activities as groups, and that's learning cooperation, et cetera, et cetera. One of the things that has to be really watched as a parent, because remember, parents and school age children need to be parents. They don't need to be their best friend. They don't need to make their kids happy. They need to keep their kids safe and happy. And of course, what they need, their necessities in life, right? But children at this age are out there and they are being influenced by other adults. And again, other children, the bullying, etc. Sure that you're involved in it. You know what's going on with them. And let them have that moment. So, how was practice today? How did Sarah do with you? Or how was Johnny today? Those things, let that child tell you if something's happening, because this is when they missed the ball and they struck out or they missed the goal or all of those things. Children can be pretty mean. So, again, it's a good thing, but it needs that parental support. Now, play. All right, we've talked about play, haven't we? And you had some questions about play on your quiz. Remember, parallel play is next to each other, leave my stuff alone, and that is toddlers. Parallel play. Preschoolers are now can all play together, but they don't do anything. There's no goal. School age children, now there is rules, there's rituals, there's ways you can win the game, and it's all set up. Cooperative play is all about school age children, because there's an activity that's going to be done, whether it's playing a board game or it's, um, building a puzzle, whatever it is, that is play. So school age children are becoming more and more aware of their bodies and their surroundings and peoples and what they can do, etc. Again, school age children want that, concrete type of, their what they do well. They want to be praised and they want to feel confidence with it, with their abilities. Body image, they're really part of them. They know now that they're heavy or they're skinny or they got freckles or they're short or they're tall. All of these things they're starting to know. They're starting to know if they have hearing aids and glasses and then braces and all of these things. Is being very aware of what's going on. They think that hair and eye color are important. The kids with the big blue eyes or those big brown eyes, or that curly hair, freckles. I mean, all of those things you can say, "Ooh, how cute," right? See, body image is influenced by those people close, and again, as we get older, and it's how we teach our children to deal with children that have hearing aids or, glasses, etc. Say, oh, it just needs some help hearing or whatever. It's no big deal. But again, it is differences and they are start noticing it. And it's how do you deal with a difference? It's like I have a red shirt on, you have a blue shirt on. So going to school, this is now you're in kindergarten, you're in school. This is where they're starting to learn things. So before this is mostly, yes, preschool gets a little bit of it, but now you're longer in school, more is expected, more work is being done, all of this in your school times, or kindergarten, first grade, etc. So again, you're going to see differences, different values and stuff. Children bringing home questions. You're like, where did these come from? Again, they've peer relationships, important. Again, nutrition, nutrition, nutrition. My dissertation for my PhD was on school age children. And my PhD is on school age children, attitude and behaviors towards injections. You have some children who don't care. Get here, go for it. And there's some kids, knowing that they're going to the doctor's office or ER and getting a shot, and you have to hold on tight or they're running the other direction. That was my dissertation. What I found out in my research, school age children, in researching children in general, is the best group. They don't have all of those extra biases that older children have, and they just tell you the truth. And it's what I found out also as I was doing it. Now, nutrition. School age children are getting more and more aware of what they're eating. Now, what we have found in with learning, like they could, a great group for me to research and work with because they love to learn what was going on and what I was doing with all that information. They love to be taught things like I've been to programs like Dare to Keep Your Kids Off Drugs, and then these nutrition programs showing children not to smoke cigarettes. There's so many things in these programs that they've had at school because this is such a great age through that school age to teach children, and teaching them proper nutrition is important. you know so lucky in this age. There's computers everywhere. Children have access, and they could go in to the internet, and My Plate is an amazing thing. Go in and plug in what you have and see what you're deficient in your food groups, and then for the projects for school, regarding that. And then for themselves, as they get older, what is a better choice for food? Because we know children that are overweight turn into be overweight adolescents and adults, and then have those cardiometabolic changes, high blood sugars, those high lipids, high blood pressure, um, if we don't catch it as school age children. So this is a great time to get nutrition. Yes, they still need to eat. Yes, they still need to grow, but they need to eat properly. So health concerns related to obesity. Well, just think about today. We know it's reaching epidemic proportions, and why? Well, I think a lot has to do with, many years ago, back, when there was Betty Crocker and there was I Love Lucy, and they would have their little aprons and cook dinner every night for their children. Well, I'm sorry, today both mothers and fathers have to work in order to make an income. So then what do you do for dinner? And then you're in school and you're working overtime. And what's for dinner? Sometimes it's easier, quick stuff. It's easy to fix, usually in a box, or it is right through one of the fast food restaurants. And we know they're high in fat, high in carbohydrates. There's nothing we can do. It's life. What we have to do to get there, but knowing that we need to pay attention to our children, especially if they're young. And like I said, they have an increased risk to be an older child with more problems. And educating them early is what we need to do in order to prevent these things from happening. So, when should we start education on obesity? And it's literally inter-utero with mom. Nutrition while she eats is important, right? And then when the baby comes, we know the first 6 months is going to be breast milk or iron fortified formula. So, after that, it's now working with parents. If you are in a doctor's office, you're working with children, it's being aware and keeping these children on a good diet, and then their height and weight on a great trajectory, for optimum health, right? That's our goal with all children, optimum. One of the things that was said, and it came out, school age children now are alert, and they can sit down with mommy and dad for dinner, and you know there is always a mom or dad who makes that child finish all their food. Now, what is said is that children should not be forced to finish their plate of food. Now, if they had a snack before dinner and they weren't supposed to, I mean, I know all of the things that go with it, but if normally they come to dinner hungry and they sit down, they don't eat food, you should not make them finish it. because in the end, they're overeating calories and they become adults that can't throw food away because they were taught to eat all their food as a child. There is research actually out on that. So just giving it to you. Sleep, school age children should be sleeping 9 to 11 hours a day. We know that it's those younger children are going to have a harder time laying down for bed because they don't want to miss anything. It's the older kids, they're like, yeah, good night, I'm going to bed. I'm going to finish reading or doing my homework and see you in the morning. So usually as they get older, bedtime's not as big of a deal. Sports is like any of those clubs and activities. Again, it's being aware, being a part of, and being talking with parents, about participating in sports, et cetera, et cetera. Another thing is today with so much these devices out there, the video games and the television, internet, and cell phones, and mount on it. Again, children want to be on them forever, watching all of whatever they are watching today. And again, it should be monitored closely. Time locks or whatever has to be done, so they're not, just going in and going through the phones and who knows what they're finding, right? Dental health. Well, I said the first tooth erupts about 6 months. That's where they say in the book. Doesn't mean they always all come out, but 6 months is when they start, just because. When they start dental health, when those teeth start coming in, again, it's more imperative than ever that children do good dental hygiene. They brush before going to bed. They say, after snacks in the morning, at night, morning and night, I'm happy. But, it's as much as we can get them to brush, it will take the sugar off their teeth and it will help them. And one of the things they say is flossing. Now, the problem is with flossing, those younger school age children don't have the dexterity to do it yet. So older kids should be flossing or parents should be helping them. I mean, they've got those little sticks now. I don't know, but this is what the book says here. So I'm giving you what that says. Prevention of dental caries, going to the dentist periodically for checkups, if there are malplaced teeth, again, getting them checked on. And what about a tooth falling out? One of the biggest teeth that come out, they fall down on the monkey bar, on the slide, on the side of the pool, and it's one of the upper front teeth that always come out. What would you do if your tooth fell out? The whole tooth fell right out. It's right there.
I'll have a heart attack.
I know you would, especially if it's a permanent tooth, right? Like, oh my God, you can see a $10,000 bill, posts, and this and that. No, you know what you do? When it's a whole tooth like that, take the tooth and put it in cold milk in a container and get them to a pediatric dentist or a pediatric ER. I know I worked in a pediatric ER many years. I've reimplanted many a front tooth with parents like you, Carol, are like, oh my God, I don't know what to do. If this tooth doesn't stick, don't have the time, the energy, or the money for this. And they'll take and numb it with numbing cream, get it good and numb, and then they push it in and they squish it in there. And then they tell them a very soft diet, see them in 2 or 3 days. Most of them reattach if they follow everything. So anybody who knows a person about a tooth, let them know. It saves a lot of money. School age children are more and more into sex education. They're seeing maybe mommy getting pregnant. They're seeing auntie getting pregnant. They want to know what's going on. Remember, as preschoolers, they're starting to masturbate and they're starting to see differences, boys and girls, right? Again, all of these things should be just very good, effective communication with the parents. Mom and dad, at times when they see little hints, need to just, sit them and let them know good touch, bad touch type things, especially as they get older. again, remember sex education, there's sex and sexuality, right? So again, first of all, ask them what they want to know and what do they know about that already. So you're not going to over give information. All level children have all different understandings. You don't want to go further than that. Okay. Again, mom and dad are probably the best choices there if possible. Now, if you were a mom like my mom who didn't tell me about anything, the school nurse is a great choice. You know, today we have more school nurses in there. I think since what COVID happened and they realized how instrumental they were. In fact, it's a great job. I mean, you get all of the holidays, kids' holidays off. You can have the summers off if you want. I mean, it is a good job. And I've had one of my other professors, is a school nurse, and she absolutely loves working with children. There's so many things they do that you don't think of. You know, yes, kid has a tummy ache, they see him, or kid has an antibiotic and they need a medicine. Yeah, of course, those stuff. But all of a sudden there's a bacterial meningitis, or all of a sudden COVID is there. What do we do? And this is the school nurse communication CDC and making sure everything's done right. So school nurse is a great position. And if the mother doesn't want to talk to children like my mother didn't, this is a good choice. Going there and asking questions about anything about sex and communicable diseases, anything. Now, injury prevention. In all age children, accidents are always injuries. Any sort of injuries, number one is motor vehicle. Whether they're in the car or not buckled incorrectly, or not buckled at all, or ran over by a car. No, believe it or not, I've seen 3 toddlers ran over by a car in their own driveway. And why do you see this? It's like they're basically preschoolers. Preschoolers are all of a sudden more mobile. They walk better. They tend to want to go. They're playing. They run behind cars. They're on their bikes, their tricycles. They're chasing a ball they don't see. Or you're out in a parking lot and they lose your hand and their car goes and they hit some. So motor vehicle crashes are big. And we know those injuries increase with preschoolers. Now, as it gets to school age, it's getting a little bit better. Okay. Now, they say the child should be in the rear seat till they're 13 years old. You know, this is newer. I know I was a single parent and I know my kids kept calling shotgun. They wanted to sit in the front passenger seat, right? Well, looking at this and starting to teach it, I realized having them in the front seat with me was not a good deal. Thank goodness I didn't have any accidents. Booster seats should be about till age 8. Rear vehicles, rear facing on an infant up to age 2. At age 2 or 30 pounds, you can turn the seat around to front facing. One of the things about school age children is they're more active now. You know, as they're younger, we've given them all of these toys and they didn't know how to use them well, whether they're skateboards and roller skates and bicycles, and they didn't know how to do it well. Now they're getting really mobile. So the one thing that it should be talked about is the appropriate safety equipment for anything. Making sure that they have helmets on with the bikes. Trampolines are something that's highest injury for ages kids 5 to 14. You know, they bounce up and down, they get stuck and they break legs, and I've seen ankles and knees and all sorts of things with it. And then one of the things is ATVs. Now, I live in South Florida. I live by Homestead, and there's the Everglades right there. A lot of big open roads, you know, far west from me. And down here, a lot of the teenage-ish type children have these ATVs, 3 wheels and 4 wheel ATVs, and they love riding down the streets and into wherever. The one thing the book says is they're not recommended for children under 16 years of age. Now, you're going to say, well, we'll watch them. They can ride it. Well, they're going to get on the ATV and go, and you're not going to see them. They just feel that a 16-year-old doesn't have the know how yet, I guess, to get out of bad situations. But the book, not recommended for children under 16. So, what's happening in school age? When they're little, they all want mom and dad or Nana Pop Pop if we're lucky, right? As they get older, they're getting into their friends, their peers' families. So now our relationship as a family is getting smaller. And this child now is opening his wings to other people, other cultures, other influences on them. ADHD is one of those things that children get. It's a repetitive, start one thing, leave it, start another thing, leave it, start another thing, leave it. So you're going to see 5 different things started and they're not finishing it. Inattentive hyperactivity. Okay. Now, many times these children with ADHD, it's usually the school that first sees this child who can't sit, who's disrupting class, and is sent to the nursing office. And now the school nurse, now this is the second, third time they're there, needs to do something, plan with the child. The child's upset, doesn't know what to do with himself. So it's not the child's fault. It's what do we need to do to help this child be able to focus and to learn? Now, what the things many people think that if a child has ADHD, it just means they're spoiled and they don't want to listen, and mommy and daddy never tell them what to do. I can't tell you how many times I've heard that. It is not that, okay? So, when these children come in, and if you ever become that school nurse, or me as that triage nurse, who's now they're coming into the ER because they want to get help, they don't know what to do. So, come into the ER, try to figure this out. Well, these children with ADHD, many of them, parents have done a lot of things already. They've taken away privileges, they've already sent them to a therapist for whatever. They've done certain things, and it's their fault. Maybe there's another couple steps they still need to do. So again, don't assume these parents aren't doing anything. First thing is, so tell me, what have we tried for your son already? And let them explain it. And then together work out a plan. Now, enuresis, urinating in the bed at nighttime. There's primary or secondary. So sometimes you're completely potty trained. And then all of a sudden, you start urinating at night. What is that telling you? It's telling you something's going on. What causes frequent urination? Well, it could be a urinary tract infection. Could be a stone blocking it from the young kid, not really possible. This could cause enuresis on a child. So the thing is, it could be diabetes mellitus, could be diabetes insipidus, it could be many other conditions that can cause this urination. So, what is the treatment? Number one, get him to the doctor. After we do all this history, physical, figure out what the possibilities is and figure out a plan for it. If the child has never urinated and does it once, it's a nothing. Some children never stop urinating and it takes them a long time. So either it's getting with the doctor to make sure it's not any other underlying condition. Now, in apheresis, sometimes children hold their stool and they don't pass it the way it should. and it gets stuck like down in the descending colon. So sometimes in the underwear, you see like smudges of stool, like liquidy, gooey. And what that is, it's the little bit of liquid around the stool, the intestines trying to come out. And at that point, when that is seen, of course, well, why is that going on? When's the last time you moved your bowels? Again, bowels are the only thing anybody can control. If you don't want to go, usually you can hold it and you don't go. I mean, occasionally there's that, but usually, and that's children, they'll hold it and it's something psych going on. Stress that they're telling me something stressful is going on here with me. So again, we start seeing this. We've looked at it. All right, let's do that structural reason. Was there something that we missed out there, right? Again, looking at diet. What does the child eat? Is there any roughage? Again, is it something stressful going on? Do they need behavioral or psychotherapy? Can you see this little hints about children where they're showing different things that these are stress, like acoparesis, enuresis, just acting out at school. These things are things that children, school age children, are going to be showing you that are telling you they're stressed. So a child has that knocked out tooth. The parents are reluctant to try to reimplant the tooth. Where should the tooth be placed for transport? What do you think, Carol?
Say that again. I'm sorry.
So where should the tooth be placed for transport?
In milk?
It's going to be in that cold milk. You know, I've had students ask me, why cold milk? You know, there's really no answer. So what would you critically think? Well,
It
it's
preserves it.
cold. It's cold, so it's like ice. And milk has calcium in it. So does
That's what I
teeth,
was
right?
thinking. Calcium.
And it keeps it cold so bacteria can't grow. So that's what
Preservative?
I was thinking. It's the only thing I could think. Okay. Now let's go on to adolescents. You know, adolescent children, these are over age 12. And this is where they go from being a kid and now they're growing up into adults. It's a really hard, tumultuous time in their lives, okay? It's rapid physical, cognitive, social, and emotional maturation, whether they want it or not. They're going to have to grow up by the time they're 18, right? And figure out what they're going to do with their life. We know that puberty starts, that secondary sex characteristics. It does start out with the, breast buds. Males, it's an enlarging testicles. And goes into where they're getting all through puberty, and that's that right into adolescent time. So as I said, it starts out with all of a sudden things are going to be changing with going into be an adolescent. They're going to have the curves and they're going to start hair growth and getting breasts. The young boys' voices all of a sudden are really deep, right? It's like amazing. Like you're talking to your best friend's son on the phone and all of a sudden his voice was deep. I'm like, whoa, when did you grow up? It's just part of it, right? And then they're getting hair on their face and their armpits and their chest and everywhere. And it's just part of it. So what do you need to know? Tanner stages of sexuality and growth, and what do you expect? Now, do you need to know all the stages 1 through 5? No. What do you need to know? Well, you need to know that in women, the beginning of puberty is the breast buds get big. That's the first thing. And then it goes up to 5, which is 2, 3, 4, 5. which is completely done. So if you had to guess, it's the more in the in-between, right? Usually they'll ask about breast buds. Now, males, it's usually that the scrotal enlarging, okay? And then of course everything goes along with it. That's at 2, and then stage 5, they're complete males. So tanners, notes about sexuality and their, menstruation, and where would they be in that according to Tanner's stage? That's what that's about. Now, pre-adolescents, they physical growth, usually 20 to 25% of their growth is their puberty. So that 2 to 3 year growth spurt, there's a lot of height and weight there. So again, this is a lot, not as much as infant, but it's more than it's been in toddlers, preschool, in the beginning of school age. It is really 20 to 25% of their total height. Okay. Obesity is associated with early onset monarch, but and girls has nothing to do with boys. And we know both sexes, their voices change. Even girls were high sopranos are now altos, and it's just voices will change, part of it. Now, Erickson, remember, you're going to be seeing these theorists on the exam. Erickson talks about a sense of identity. Adolescent identity. What are they trying to do? Well, who am I? What am I? What am I going to be? Do I like girls? Do I like boys? Do I want to be in the drama club? I want to be in the sports team, or do I want to be in the 4-H? I mean, all of these things. Also, the way am I dressed? Too many pimples, too many freckles, too curly hair, too straight hair, too short hair. Identity, they're really into too fat, too skinny. This is a horrible time of thinking about you and who you are and not liking you very much. Even if you are a very pretty person, it doesn't matter. It's just part of that adolescent struggle. Identity. And it's versus role confusion, as in, what am I gonna be? What role am I gonna assume in society? Okay. One of the things Erickson, talks about in psychosocial, again, now we're talking stress in children, different ways they show it. Now, here we are in adolescence. Any warning signs of suicide should be taken seriously. Even if they say my friend wants to, kill himself, take it seriously. Adolescents do have a high rate of suicide, body image, and not liking themselves very much. And it does cause bad depression. Okay, take it seriously. If you start seeing them sleeping too much, not sleeping enough, irritable, eating too much, not enough, not wanting to go anywhere, or start just talking about death and dying for no reason. These are things, take it seriously. It needs attention. So adolescents are all into about their peers being accepted, all about their body image. They are now withdrawing from the parents. They want to be their own people. They want to do what they want to do when they want to do it. It's just part of adolescence, right? So parents, the relationship, it starts at that school age and younger, protection and dependency. And now we're getting almost up to that point of mutual affection and equality, right? So one of the things teenagers now have to work and understand is there are privileges, but there's responsibilities to get privileges. And it's whatever that parent says. And we all have our own what might be. It might be you must get good grades in school. You must go to school every day. You must keep your room clean. You do your chore every whatever. I mean, these are things that are responsibilities. So that when they want to go to the movies with their friends, mommy will have money for that, right? Because, you know, they're doing what they're supposed to do. I mean, I know for me, you better tell me 2 weeks in advance if you want to give me extra money for stuff like that, you know, because who has extra money? But it's what a teenager should be doing. What happens is that age, now they're 15, they're over that pre-adolescent growth spurt. They're starting to look older. You know, boys are getting little hair on their chins. And now you start seeing that major conflict. Again, it's over that control of, I don't want to do those responsibilities. I'm supposed to go out and play basketball with my buddies. And you're like, well, you're first going to do whatever that was you're supposed to be doing. And this is something, adolescents and parents, it is a struggle. It is a struggle. So parents many times will come up and like, what can you do? And actually, what they recommend is just to sit down with their child and together compromise and work up something that's workable. You know, this kid wants to stay out till 2 o'clock in the morning, and you're like, midnight's pushing it for me, but I'll go to 12. Well, let's see if we can work that out. Or, you know, what can happen so we both can be happy here. It's hard. It's an ongoing turmoil. I know I fought with my kids the whole way through. Relationships with peers. Now, at school age children, their same-sex peers, they want to be in basketball with them. They want to play soccer with them. They'll change everything they do to be with their best friend, their peer. That's just part of it. As they get into these adolescents, what they're doing is they're going to fit in that group what they want, whether it's, you know, the drama group or the band group or the art group or the, you know, whatever group. And they gives them that the feeling of like belonging, like they feel together, that they're strong. They don't feel alone. Because remember, adolescents, they don't feel that they're good enough, their body image, they don't have that confidence yet. And that peer group gives them that confidence. Now, through all these things, there's going to be that best friend. Most of them, yeah, are same sex. Doesn't mean all of them. Um, I grew up with 6 brothers. My best friend was a man, but that's different. But again, best friends. But what they say about the best friend, the way you treat your best friend as an adolescent is a hint of how you're going to treat your partner for life. If you don't treat them well, it's your partner for life is not going to be treated well either. Now, how to get rapport with an adolescent? Well, adolescents, they're always looking, they're cautious, they, you know, don't feel like they can trust you. So again, it starts with, you know, maybe I'll see a New York Yankees hat on. And I'll say, oh, cool, you like the Yankees. Or maybe they've got a new pair of sneakers, Nike sneakers. I go, wow, where'd you find them? I've been looking for them. Or something, you know, something that they have that could start some sort of conversation. Or, you know, have you decided on your college yet? Some will, some won't. Again, you've started a rapport. You're becoming less threatening. Another thing is, let's say you have an adolescent girl that comes in, her hair is sort of shorter and she's more masculine in appearance. Now, and you see what her name is. The one thing that I'll always say, so what would you like me to call you? And I've gotten a lot of respect several times for doing that. Once female and once with a male. So these things are going to happen. It's just life. It's if they're happy, I'm happy. So how do we talk to adolescents? Well, number one, you can ask parents to leave the room, especially if all the signs and symptoms are looking like it's probably a sexual transmitted urinary tract infection or disease or something. And then you could talk with them. Again, giving them the opportunity to talk without any biases. And I'll warn you, the one thing teenagers do like to do, they like to tell you things to shock you. And be prepared. They will shock you. So I always try to put on that face when I go in the room. One of the things I also will tell these adolescents that say, I can't talk to my mom or dad, they don't listen. I will send them to the school nurse. Always a great thing. So, healthcare, adolescents, they get that 3-shot HPV series. Know that boys can get HPV series too, because remember, boys give to girls. All right. Nutrition. Now, why is nutrition here with adolescents? Remember, I just had that pre-adolescent growth spurt and all that weight and height was done? Well, guess what? They do need to eat during that time because they are gaining height and weight a lot and they need it for nutrition. Now, adolescents tend to, they'll get a some sort of bar and a bottle of water, put it in their backpacks and run for the day. And many times don't stop to eat, or they're saving the money to do something on the weekends. That's, what children do, right? Because of that, not always do they get proper nutrition. So if an adolescent too skinny, maybe a little overweight, how would you treat that? How would you know what to do? Anytime, and it doesn't matter from infant to adolescent, you're worried about a weight for whatever reason, get a diary, 24-hour diary minimum. It's really going to show you what they're eating and what they could change. They should be getting a lot of rest, but they're on their phones. They got a new boyfriend. They got a new friend. Oh, they won the game. So they're so happy. Oh, I got to study for my test now. And they get to sleep 4 o'clock and get up at 6, go to school the next day. And that's just what they do. Again, remember, they do need their sleep, but we know it's schoolwork, social activities, and their buddies. Is all going to stop that sleep getting what they should. They should exercise, and again, they should be taking care of their teeth, brushing, and flossing. Again, sexuality, I've talked about that. Safety promotion, well, guess what? Those accidents, they're driving now. So there are a lot more motor vehicle accidents occurring with them, not necessarily when they're driving. Kids hop on the outside of the car and they spin around in parking lots and do all sorts of crazy things. I remember watching it. So again, those happen. Just sports injuries, firearms, always, because now they're exploring. They couldn't look at their daddy's or uncle's gun when they were younger. Well, now they're going to look. And of course, injury prevention, wearing good equipment, etc., is important. So Matt is 14. He's always eating, although his weight is appropriate for his height. What's the best explanation for this? Well, the answer to this question is at 14, he's in that pre-adolescent growth spurt. He's gaining 20 to 25% of his body weight and height during those 2 to 3 years. So guess what? Absolutely normal. This is like an infant gaining a lot of weight. Eating, but they look normal. It's because they need it. All right. So now we know all about school age and adolescence and all those little particular differences with it. Well, let's quick get to our Cahoots. It's like 30 some odd today. Not bad. I think my computer has a mind of its own sometimes. Have I put anybody to sleep yet?
Are we participating? We doing it from our phone? Like, how does this work?
Okay, what I want you to do is get your phone, put it on camera, and hover it over the UPC code there.
Oh, okay.
Click that site. That easy.
My phone is dead.
That's okay. Then just look at it,
Thank
Tamika,
you.
and figure out what you might answer, okay? So the questions will be on the computer. You answer it on your phone. Only the colors will be there. All right, let's get going. Let's try to push through them and get you out here, as I said a little bit early. School age and adolescence, ages 6 up to 20. How does the onset of puberty growth spurt compare in girls and boys? Pubertal growth spurt. Say that 3 times fast. Pubertal. You know, the one thing about children and taking pediatrics, it's difficult when you have children. I'm going to tell you, forget you have children when you're doing exams and quizzes, because there are a lot of subtle differences. Yes, girls mature puberty before boys by 2 years, usually 10 and 12. Say, what activities are appropriate for a 6-year-old child? Remember, they're more active, they're more they're more agile. Remember, 6-year-olds still mentally, they're still kids. So the only thing I wouldn't put them in is competitive sports, only because they're too young yet to handle all of that, bullying and things that can occur there. Now, I'm not saying it's not right for all kids. The book says it that way, okay? Hopscotch, riding bike, jumping rope. You see, it's on 1 foot jumping these things. And fine motor skills. We're going to do our fingers, buttons, and circles. At what age should a parent expect to have major conflicts over independence and control of their child? What age? Are they going to all of a sudden say, I can't do this, mom? And that's right after that pre-adolescent growth spurt. Right there is at 15. Now they've grown up, they're tall, they're looking like they're men and women, and this is where we're going to have that fight. Signs of onset of puberty in girls is remember, girls, as their breast buds, all of a sudden you see them and you know it's coming soon. The onset of puberty in boys is characterized by easier to see girls than it is boys for parents. And that is testicular enlargement. That is the first one. Not uncommon for people to choose that voice changes. It's testicular enlargement and a breast nipples. What do we use to determine if a female has reached the age of menarche? What form are you going to use there? What did I tell you? When do you know this stuff is going on? So this is Tanner staging. Remember, 1, there's still a child. 2, you've got the enlarged nipples on the girl. 5, they're completely matured. So you can pick out that in between a lot easier. It was a HESI question I saw. A child goes to the ER with a low fever, pruritic rashes, and open oozing papules. Nursing care includes Well, they're telling you a lot of stuff here. What do you think this could be? I've seen many of these come into the ER. And my concern is these oozing papules and fever. Probably this is chickenpox. With that fever, that itchy rashes, oozy papules, and then it's at different stages of healing would be the other part. But what am I going to be worried about with chickenpox? And these were some questions you needed to know. Chickenpox is airborne. Put on the N95 mask for yourself and get that child a mask and get them into a negative pressure room until the chickenpox diagnosis is taken away. Better to be safe than it is sorry. The source of injury, whether intentional or unintentional in adolescence, is associated with injuries. Children, all ages. What is it? Motor vehicle. Very good. A 9-year-old friend tells him soccer's a dumb game and he should play baseball. Why is he telling him that? Okay, school-age child. Freud says same-sex peers, loves the acceptance. Friend wants to play soccer. He wants to play baseball. Because peer acceptance is very important, the one child will do what the other one wants, whether they want it or not. They want not to upset their same-sex peer friend, according to Freud. During admission, the father of a 16-year-old boy says, "We're Buddhist. Culturally competent care includes what?" I lived in New York. It's a very small town with hardly any culture in it. And I moved to Miami and I was in my 20s. And I was flooded with so many cultures, I didn't know which way to turn. So the one thing I learned quick, I don't, whatever they are, I didn't even put a name on them. I would just say, I don't know what you practice. I don't know your beliefs, but is there anything I need to know so I can take care of your son, your daughter? They appreciate that so much. The respect from just that question. When teaching sex education and contraceptive for adolescents, what should the nurse consider? So adolescents, can the nurse teach them? Number one. So what they say is if a teenager comes to you as a nurse and wants information regarding sex education or contraceptives, what we can do is not our opinion. We can give them written and oral information, accurate information. We can give them without a parental consent. A multi. The management of adolescent obesity should include, she's got an adolescent, it's overweight. They're already into that body image and not feeling good about themselves, right? So anything to do with management of food, diet, any age child, that diary, that's number one. Very good. Now, incorporate some favorite foods into their diet. Maybe having a little ice cream on Sundays. I mean, that's something to look forward to. Diversion, younger kids, and nutritious foods as a method of reward. Here's some carrots. You've been good, so there's your reward. That doesn't work. What action would improve dental health in this school age child? You know, and remember with school age children, all their baby teeth are going to be coming out. So it's not uncommon that the mom says, yeah, the child's lost 3 teeth. What am I going to do? Well, it's normal unless they're the permanent teeth, right? So floss whenever they can. An 8-year-old girl says that she has cancer because God is punishing her for being bad. Why is she saying that? She broke her arm. She's upset. She's angry at herself. So preschoolers, school age, both feel if they are injured, broken leg or arm, or get sick, or their appendix, needs coming out, they all feel that they did something wrong, hit their brother, got a C on a grade on a test. All these things they think is so bad. This is normal, very, very normal. And again, I tell you, I do tell these children, you didn't do anything and God's not upset with you. A 6-year-old needs to get a chest x-ray. What explanation is best? So 6-year-old versus a 12-year-old. 6 years old, I'm going to take a big camera and take a picture at you. Because again, think about it. What are these kids taught today with all these superheroes? Spider-Man with things coming out of their wrists, things coming out of eyes. You got to make sure nothing's going to go into you and hurt you. It's a picture like a camera, but it's the insides. How can you get an adolescent to be more receptive to talking about their health and sexual explorations? Have the parents out of the room. And sometimes, if you build up enough rapport before that, these children will talk to you. And I tell them, I said, I don't have to tell your mom what you're telling me. But if it's something that can hurt you or somebody else, I have to tell them. But I don't have to tell them that that. Because sometimes it's what they want to hear. A child has a knocked out tooth. Where should the tooth be placed for transport? You see, there's that little boy with the missing 2 front teeth. I love that picture. Cold milk. Yes, very good. A nurse planning care for a school-age child should know which thought process is seen. School-age child, how do they think? What did I say? First of all, I told you that there's concrete. They have to see it, know it, feel it, touch it, and they can do it. But they also have the ability to look at things that are the same in different forms, and they call that ability to conserve. Why they call it ability to conserve, I don't know. But conserve, is it big? Is it small? It's the same. That's the conservation, I guess. What stage of Erickson would you use for a school-age child? School-age children now. They do things well, and they want to do everything well, but they can't. That is, in a nutshell, Erickson. It is industry. I felt it, touched it, saw it, and I can do that because I have concrete information here. Okay? That's my industry. I can do it because that's it. And then inferiority is I can't do everything well. So I do something well, and then I can't do everything. School age children's moral development. Remember, that's Kohlberg. Moral development is always Kohlberg. And know that young kids, the infants and toddlers, don't really understand morality. The preschoolers do. And preschoolers all about reward and punishment. School age, they want to please adults. That's their goal. They want to please. Multi. Anorexia nervosa is characterized by. Now, I didn't put this into the PowerPoint. There's only a couple key concepts I wanted you to know about them. Usually we're talking about anorexia nervosa. This is usually that adolescence, right? And the problem with anorexia nervosa is they feel like they're fat if they see a little pinch, and they're these skinny little people with their bones, unrealistic. It's severe calorie restriction, a fear of weight gain, unrealistic body image. They're going to exercise like crazy, drink water, and have a leaf of lettuce. That's anorexia nervosa, that limitation. What behaviors would you see with a child with bulimia? Now, bulimia is just as bad as anorexia nervosa. So with bulimia, they eat, and then throw up everywhere. These are these children that in adolescence you would watch after they eat, make sure they don't go to the bathroom and get rid of it. The difference between anorexia nervosa and bulimia, if you saw a child with true bulimia, their front teeth probably would be rotten out from the gastric acid, from the all the vomiting, and that gastric acid burns their teeth out. What is an adolescent's heart rate? Not quite an adult, but almost there. I just put this slide up to show you that heart rates are important depending on a question. They tend to be a little bit more effective. So 55 to 90, where adults are 60 to 100. When talking with an adolescent regarding personal health concerns, which is most important? Now they're talking to you. Mommy left the room. Let them be honest. Let them open up. And I'm telling you, hold on. I've heard some things that I didn't think adolescents did. But again, guiding them towards the real information is what we needed to do, which is what I did. A parent says their infant puts everything in their mouth. Based on Freud's theory, you would respond. Always bring some concepts back that I want you to revisit. You'll always see a couple of those questions. And usually those questions, higher priority for understanding for your exam. Again, infants explore the world through their mouths. They also soothe themselves within their mouth. It just makes everything all better. A multi. What could be a sign of potential child abuse? As I said, child abuse is something that is horrible to see. But again, as a nurse, your responsibility is to always be aware and to report it if you suspect. And the biggest thing is that inconsistency between the injuries noted and the history. But then you'll see other little stuff like different stories, and then the child's afraid to talk. Believe it or not, it's not an answer here, but sometimes the person who was the abuser, it just acts like everything's okay. In fact, that's what I saw in the couple cases I saw. Ugh. In school age conflict of industry versus inferiority, what does industry mean? What is an industry? It's a factory. It's their house. It's their product. It's what they do well. They master a task. Roy talks about same-sex peers, so that's the friend that you're thinking about with that one. But industry versus inferiority, Erickson's psychosocial. I can do this really, really well. And what I can't do is that inferiority. So I want to do it all well. What clinical finding does not indicate an adolescent may be suffering from anorexia nervosa? What's not anorexia nervosa? So again, bulimia is the teeth. That dry skin, intolerance, constipation, absolutely. Those are also signs against hypothyroidism, all three of those. Cooperative play. So knowing what the plays are for the exam is important. Toddlers is always parallel, preschoolers associative, and cooperative play are your school age. It is two or more children working together to reach a goal, something. Somebody wins a board game or they finish the house or whatever it is. Common goal, they reach it, they work together. What does moral development involve? So remember, infants and toddlers don't have any morals to start with, and they start learning. And they start understanding there's right and wrong, and something happens when you're good. I like that. Bad. Oh, I don't like that. So they start to learn. Developmental milestones are important to observe because why do you need to know that they sit up unsupported at 8 months? Why do you need to know that they roll over by 6 months? Why do you need to know their head comes up with them at 3 months? Why is that all that important? Because if you are 8 months old and you can't lift your head up, it's a head lag and things not right. And we really need to find out. So there are clues to institute early intervention. Find out what's going on, do the testing and speech, physical, occupational therapy, whatever they need. Get it going. Get that kid caught up quick. Which of the following immunizations is given in the adolescent stage? Dose the HPV. Remember, it's a 3-dose series. ADHD most likely involves which of the following? Inattention, distraction, impulsivity, and a hyperactivity. They can't sit still. Usually they start seeing this in the classroom, and that's where it starts. A multi. An adolescent has been brought to the ER with a drug overdose. What's initial questions to ask? So your adolescents come, they're on a drug overdose. Well, they're able to talk to you, so what do you need to ask? So we need to know what they took, when they took it, and the route. If they give it IV, it wears off quicker. If they took it orally, it lasts longer. So we as healthcare professionals need to know and then we can give whatever antidote if we need to give that antidote to it. I mean, rehab's not even in the question now. A 9-year-old recently had some stomach pains in school. Also, the child's been aggressive and stubborn. The reason for this, why kid all of a sudden recently started this? What did I tell you about children who all of a sudden are incontinent or, constipated or abdominal pains or angry and doing things? The signs of stress. And this is sometimes all you will see. Something's going on. We need to figure it out. Next question. A multi. A nurse teaches a safety course to school-age children about their community. What should she include? Well, of course, many school-age children come home. Some have parents there and some don't. Again, show them how to use a microwave. They might want to have a quick snack. Water safety will always be there, always be there. And then, of course, appropriate car restraint. 8 years old and less, put them in that booster seat, and above that, always in the back seat. Fearing strangers by school-age children, it should be a given. But I'll go along with that. It could be. EK, number 3. Number 2, meat. Good job, meat. Carol, good job, Carol. And Cindy D and Jazz. So we got our cahoots in, we got this in. Remember, this week is all the reviews. Anybody who wants one-to-one on it, let me know. I can meet with you. Thursdays and Fridays are great days for me. Late morning, afternoon, I can get with you, or early evening, if you need to meet, whether it's for a review or whether it's for some dosage calc review, if that's what you need. I'm doing my review Thursday, 4:00. If you want to join me, fine. If not, again, you'll know it's going to be on my YouTube channel. And you have last quarter's YouTube channel if you want to watch another exam 1 review. They're just about the same. Remember to think about your pediatric assessment. Let me know. I have to approve it, before you start it, to make sure I don't have one of everything. I want not 5 of these and nothing else. I like a little mixture. I like to learn something, so teach me. Anyway, have a great night, everybody. I'll see you next week. Remember to come in on your phones. Make sure everything's charged up. Again, let me know if you need me. Take care, guys.
Good night.
You too.